Hi, my name is Julie. I'm going to be your nurse practitioner student today. I'm a student with United States University. How are you?
I'm well.
What's your name?
James Alexander.
Okay, James. Can you tell me what year it is?
2019.
Okay, can you tell me who the president is?
Donald Trump.
Okay. I'm going to be recording this for my school and the faculty to look, and it's going to be uploaded to YouTube. Can you consent by saying, James, I consent?
James, I consent.
Okay. You can go ahead and lie down. Okay. So, before I begin the exam, I'm going to wash my hands, okay? Okay. Alright. So, can you uncover your belly, your abdomen for me? Okay. What I'm doing, I'm just going to do an inspection of your abdomen, making sure that I don't see any abnormalities of growth, any masses. I'm making sure I don't see any abnormal moles or skin lesions. I'm making sure I don't see any surgical wounds, old surgical scars, because old surgical scars means that they've had surgery in that area, which he don't. And I'm also looking at the umbilicus to make sure that it's normal in color and there's not any lesions or growth on that area too. I'm also looking for peristalsis to make sure if I see that, then I know that there could be an increased activity of the bowels. And I'm checking the aorta to making sure that I can see, making sure that I don't see any pulsation jumping out at me. I'm also looking at the skin color to making sure I don't see any jaundice. At that time, I'll also look at his sclera to make sure that it's not yellow, that they're nice and white, and his are. And after the inspection, then we'll go ahead and listen. We do auscultation, which would mean we'll listen to your abdomen, okay?
Okay.
I'm going to get my stethoscope. I'm checking for bowel sounds. Bowel sounds are usually heard every 5 to 30 seconds in a minute. And I hear his bowel sounds are pretty good up high. And I'm checking all 4 quadrants. They're a little hypoactive below. And after checking your bowel sounds, then I'll listen to your aorta pulse. You come up above the umbilicus, between the umbilicus and the diaphragm. Then I listen to your renal arteries. They're just on the outside of the aorta. You have to press down hard to hear those. Then I'm going to check your femoral arteries. Okay. Then you can also use the bell to listen to all those sides. Okay. And I'm checking for turbulence and bruit when I'm assessing the arteries and the aorta, which yours sounds normal. Okay? Good. Next, after that, we have palpation and percussion. I'm going to do the percussion and then I'm going to do your palpation, okay? Okay. And I'm listening for tympanic, which I hear tympanic over his abdomen, just a little dull in the lower areas of his abdomen, on the left and the right quadrant. Next, I'm going to palpate the liver, and at the same time, I'll be doing the liver span. Okay, then we put a mark there. just have to put a mark there. And then we come and we're going to start from the top. And we're going from dove to tympanic. And it's right here. And to measure his would be, his is 5 centimeters. Okay? Now I'm going to palpate the spleen. We find the rib, the 10th rib, and we kind of count up from the rib to palpate the spleen. Okay. Everything seems to be in order for the spleen. Next, we're going to percuss. I'm sorry, that was percussion. Next, we're going to palpate. I'm going to start off with a light palpation. I was percussing first. This is palpation. Any pain? Okay. Then I'm going to do a deeper palpation. Any pain?
No.
Okay. Now I'm going to check the. I percuss the spleen area first. Now I'm going to palpate this for the spleen, and I shouldn't be able to feel it. Take a deep breath for me. Okay, like that. Okay, and I didn't feel anything abnormal. I felt his rib. Now I'm going to palpate the liver. Take a deep breath for me. Okay. Okay, good. The liver should be at least 1 centimeter below the rib cage, and in his case, everything is normal. It's not enlarged. He's not enlarged. Okay. Now I'm going to do a test called the Murphy test, where I check to see how your gallbladder is. Okay. So I'm going to put pressure here and take a deep breath. Any pain?
No.
Okay. The whole time while I'm doing palpating, I'm watching his face, making sure I don't see any grimaces or frowning, because sometimes people don't think pain is pain if it's not something severe. Next, I'm going to do the McBurney's test, and that's testing to see if he has appendicitis. And I'll find my markings from the umbilicus, and I'll make it to the iliac crest, iliac spine. I'll make an imaginary line, and I'll go between that line. Any pain?
No.
And he does not complain of any pain. Next, I'm going to do the fluid shift test, and that's to test for ascites. If you turn over, bend this knee and turn over to your right side. And anybody that has ascites, if they had fluid, it would shift all the way here, and then you can come up and palpate this area, which should sound tympanic. In his case, he's fine. He does not have any ascites. Okay, can you sit up for me and turn your legs toward this way? I'm gonna do this coastal vertebral angle to check tenderness, and this to check to see how your kidneys, if you're having kidney pain. Okay.
Okay.
And also, I'm gonna do this direct and indirect. So I'll do indirect first. Any pain?
No.
Any pain?
No.
Okay. Any pain?
No.
Any pain?
No.
Okay. If you'll lay back down one more time, I want to go back and make sure that we palpate and make sure your bladder is okay. Okay. And checking the abdomen, you also have to make sure that the bladder is okay. Any tenderness?
No.
Okay. And if the bladder was distended, or if he was having a hard time going, that would be one of the things to look out for. Do you have any questions about your exam?
No.
Okay. Thank you for giving me this opportunity, okay?
Thank you.